All right, hello there, Sierra Nevadans. Just wanted to respond to a question that we had from Shanna Levine yesterday. We put out a little video with an update, and she had a good question about what to do about outpatients, folks who are not in the hospital. Are there any treatment options? So I decided to enlist a little support from one of my colleagues over here, Dr. Baidwan. He's a hospitalist, which means that he is a physician who specializes in hospital medicine, but he also knows a lot about coronavirus and what's happening with all the research and everything. So let's turn it over to Dr. Baidwan and see what he has to say about this question.
Hi, my name is Dr. Avi Baidwan. I'm a hospitalist at Sierra Nevada Memorial Hospital, and we had a question from a member of the community asking whether there were any treatment options for those who have tested positive for COVID as an outpatient. I know that is an option for most of the patients that even if you have been tested positive, you could stay at home and manage your symptoms there. So in a nutshell, the answer is there is no proven treatment for this as an outpatient. This is according to the Infectious Disease Society of America guidelines. All the treatment regimens, including hydroxychloroquine, azithromycin, remdesivir, tocilizumab, and other experimental modalities, they're still under research, and none of them have proven to be clinically of any benefit compared to just conservative management, which is what we typically do for any viral infection, and that mainly is hydration, maintaining adequate nutrition. Vitamin C, there's no harm in that, so I would recommend you to take vitamin C at home. And other than that, one thing I would recommend is knowing the symptoms, and over 90% of these patients have fever. So if you have fever, then do not disregard that. And by fever, I also mean not taking Tylenol, because taking Tylenol would mask your symptoms of a fever and give you a false sense of security. So if you're having fevers without taking Tylenol, you should absolutely not take aspirin, and do not take steroids. If you're on steroids chronically, then yes, you can take them, but the steroids are not recommended in an outpatient setting as a new treatment modality. And one more thing I would recommend is getting an oxygen meter. If you're very concerned about shortness of breath, then you can track your oxygen numbers at home, and if it is below 89% or in the low 90s, and you're having this feeling of like a band around your chest and having difficulty taking a full breath, then those will be the signs for you to come to the hospital and get checked out. But if you're worried about shortness of breath, then a pulse oximeter, which is available at any pharmacy, would be a good option. Other than that, yes, friends, as of right now, there is no FDA-approved treatment for this as an outpatient basis.